Happy Friday, everybody. What a week it has been. Welcome to our daily Two on Your Side Town Hall. I'm Kate Welsh, chauffeur.
Hi, everybody. I'm Michael Wooten. 849-2200 is the number if you would like to text us any questions or comments. We're going to pose some of those questions to our live guest in a moment, the chair of the Niagara County Legislature, as we zero in on that part of Western New York and the fight against COVID-19.
Plus, you have heard the warnings about having big gatherings for Thanksgiving, the science behind that. And Dr. John answers a common question: what about college kids coming home for the holiday?
And then later on in the show, we have some Decision 2020 updates, including a question about why the vote is taking so long to be fully counted here in New York State.
But first up tonight, as we head into the weekend now, let's talk about where we stand here in Western New York as far as the COVID-19 pandemic. Starting with the percent positive rate. So remember, this is the percentage of people getting tested who come back positive.
You can see there for many months we kept it well below 2% in this 5-county region, but it's been going up with so many new cases. Our current 7-day rolling average is now at 4.8%, and literally 2 or 3 minutes ago we got today's numbers showing a 4.1% region-wide. It's the second straight day that it was at that rate.
And that is still the highest in all of New York State. As for our region, we have talked a lot about Erie County, with much of it now moved into the orange zone. Right now, though, let's see how it's looking in Niagara County.
Yeah, these are the new daily cases dating back to the beginning of this month. You can see there has certainly been an uptick, although not at as high a rate as Western New York as a whole. So what are we to make about what's happening specifically in Niagara County?
We have just the person to ask. Joining us live is Becky Wydysh. She is the chair of the Niagara County Legislature. We so appreciate you taking the time. Thank you, Becky, for being here.
Thank you for having me.
Let me start by just asking you for your assessment of what's happening in Niagara County. We could see there has certainly been an uptick in cases, but that has been the case in almost every county in the United States of America. What are you hearing from your public health experts?
We've certainly seen that uptick here in Niagara County after, about the last 2 weeks or so. Through the summer, we were doing very well. Our numbers were hovering around 1% or just slightly higher for several weeks in a row. We were doing great. And then just the last few weeks, it's steadily gone up. I believe today we were at 4.1% for our 7-day rolling average. So an uptick that we're concerned about. And clearly the state is as well, putting part of Niagara County into a yellow zone. So we're watching those numbers very closely every day.
Yeah, and as you know, the Erie County is in the orange zone, which means that things like hair salons and gyms closing, along with some other businesses. Restaurants can't do indoor dining. One of the worries is that people will just then go to Niagara County to do all those things, and maybe an economic boost there, but it's a different story, certainly from a public health standpoint. Are you worried about that and what could happen in Niagara County because of it?
We know that that's a possibility. There are people who are going to want to eat out. They're going to come into Niagara County to do those things, and there are no travel restrictions between the color zones. So certainly we don't have a right to ask or turn them away. What we are asking is that everyone act responsibly, of course. If you consider a trip essential and you're coming into Niagara County from one of those areas with higher numbers, we ask you to absolutely be wearing your masks. Follow the distancing guidelines. We're also, of course, asking our businesses to keep following the rules and guidelines that we've had in place here in Niagara County since the beginning. We still have capacity levels in areas that aren't in a color zone. We still have rules about wearing masks inside of businesses. So really the hope is that even if we do see some increased numbers here, as long as those businesses are following the guidelines that have been in place all along, those numbers shouldn't be overwhelming. I would say if you are trying to come in from another area, keep in mind you might have a harder time getting a table. You'll have a longer wait because those capacities might be met. But again, we ask people to really think about what's essential as far as their outings and be responsible if you are going out and about.
Of course, it's the state that is determining which of these micro-cluster areas move into the yellow zone or the orange zone, or we hope not, but maybe the red zone. Have you had any contact with the governor's office or state health in terms of your views about Niagara County and which areas you think we should maybe be watching closely to see if they move into a zone that has more restrictions? I mean, you had mentioned North Tonawanda right now is the only part of Niagara County, and it is in the yellow zone or the lowest level of restrictions.
The yellow zone also does include a very small portion of the town of Wheatfield that abuts the city of North Tonawanda, south of Niagara Falls Boulevard, which of course our residents should be aware of. You can check that map on the state website if you're not sure if you're in the yellow zone or not. But I have had contact with the governor's office. Of course, I'm still on regional control rooms with all of the other Western New York leaders and Lieutenant Governor Hochul. We're doing those calls 3 days a week still. So we talk regularly and discuss these numbers and keep an eye on them and share information. I also was contacted by the governor's office the night before he announced that we were going into a yellow zone. I was given the preliminary map to take a look at and give feedback on, and they were very receptive to the feedback that I had. They tend to use zip codes to determine those areas, and part of the problem in Niagara County is that zip codes can cross over between municipalities, which is how you end up with a portion of Wheatfield included. So they were very receptive to my feedback. There were some more rural areas in that zip code that did not have high numbers of cases, and they were willing to scale back that zone slightly for me to fit the situation and what was warranted.
We've been seeing more people wanting to get tested now. Can you give us an update on the testing situation in Niagara County? Because we are seeing shortages across the country. We're certainly not immune to that. What is your advice to people who feel they need to get tested?
Well, absolutely. If you have symptoms, you need to be tested. That's not a question. And if you think that you've had contact with someone who could be positive, it's a good idea. Or even if you just work out and about in the public, if you're around a lot of people, it's a good idea to check. We have many, many sites across the county that are available for you. If you go to niagaracounty.com, there is a link at the top of the page where you can check all of those testing sites. We do know that most require a pre-registration, so you're going to want to call to make that appointment before you go, especially right now. We're seeing more people coming out. The last 2 days, we're seeing record numbers of people coming out for tests. Our NCCC testing site that is run by the state has been one of our most popular because there is no fee there, for one thing, so people like that one. They are increasing their capacity for us. They were taking 2 cars at a time. Now they're asking more National Guard members to come in to be able to process 4 cars at a time because they are seeing increased calls for appointments at that location. So the testing is available. We encourage people to go out and get tested. That's very important for us to know as officials, as we work with the businesses and I work with the state. We need to know what those infection rates are. And of course, if you are positive, we want to make sure that our contact tracing team is speaking with you and we're helping to curb the spread of that virus if you have it.
I was just on your website a short time ago looking at all those different testing sites, and there was a big bump. You mentioned it was either yesterday or the day before in the total number of people tested in Niagara County, which is always a good sign. But just to follow up on that, are you seeing pretty quick turnaround in getting results? Because I know that's been a problem in so many areas. It's like, you know, if it takes me 4 or 5 days to get the results, how good is the test?
Right, and that's always a concern. For a very long stretch of time, we were seeing as quick as a 1 to 2 day turnaround from that NCCC site. Now, every site uses a different lab. Of course, those turnaround times can be different between sites, depending on the lab, depending on how many tests they're doing. So it definitely ebbs and flows. Right now, because that state site is seeing more people coming through, it is taking a little bit longer. We're hoping that that will change back and be quick again, because you're right. The faster you can get those results, the better. What we tell everyone is if you've gone to get a test, it means you have a reason to believe you could test positive. And if that's the case, you really should be staying home and away from other people until you have those test results and you're sure.
We've been chatting with Niagara County Legislature Chair Becky Wydysh. Becky, thank you so much, because we've had a lot of people wanting to hear more conversation that goes beyond Erie County. So we really appreciate your time.
I do as well. Thank you so much.
Great to see you. Thank you very much.